Alors, bonjour à tous.
Hello, everyone. Dear colleagues, welcome to this press conference for the update on the Quebec situation about COVID-19. The Premier of Quebec, Mr. François Legault, is together today with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health, Dr. Horatio Arruda. Mr. Premier. Yes. Hello, everyone. First, you will notice that I'm wearing glasses today. I saw that Dr. Barrette said that he had noticed for the past few days that I had a problem with my left eye. He's half right, it's my right eye. And I want to tell you that they're not pink glasses or lenses. I'd like to come back on mask wearing. First, I wish to tell you the one that I'm wearing, and you shouldn't touch the material, I understood that yesterday, is made by Tricot Maxime in Ville-Saint-Laurent. So bravo, they make quite a few of them. And so yes, I strongly suggest to all Quebecers to wear a mask when they leave their home. Of course, this question that has come over and over again since yesterday is why we don't make mask wearing mandatory, for example, in public transportation. And the answer, well, the most important, the most pertinent, is that the masks themselves have to be available. And I'll give you just one number. In the Montreal metro, usually, we're not in a normal period right now, but usually there's 500,000 people per day who take the Montreal metro. That means that if we wish to supply masks to all Quebecers who use the buses, the metro, everywhere in Quebec, we would need tens of millions of masks. And on top of that, there's the legal aspect of it. Not only do we have to supply the masks, but they have to be high-quality masks as well, because there's a lot of different kinds of masks. Some protect more than others. So just to tell you that we're working very hard right now. We have a team who's been on that for a few weeks now to work with Quebec companies who could provide us with tens of millions of masks, but that still will require a few weeks. So, you know, they don't even want to tell me a date because they're telling me that it won't be before the 1st of June. So that is the essential reason. We are going to help. You know, I see the mayor of Montreal, for example, Valérie Plante, whom we're ready to finance the masks, but we have to make sure that quality masks be available before even thinking of making that mandatory. However, I wish to invite Quebecers. There's many examples on social media where you can fairly easily make your own masks. I would invite you to go to different websites that show a lot of examples of how to make your own mask. So I'd like to come back to the day's numbers. We now have 89 deaths, a total of 3,220. So first, I, of course, offer my condolences to all the families, loved ones. And I also perhaps would wish to tell the families of the victims that this morning at the National Assembly, all the MLAs who were there, MNAs were observed a moment of silence. And today we put the flag of Quebec in half-mast as a tribute to all victims on our parliamentary mast. Today we have 39,431 cases, an increase of 706. 1,876 people hospitalized, 194 in ICU. That is an increase of 8 people in ICU and 36 people hospitalized. Another subject on which I want to come back are the tests. Very important. That's part of the conditions of the WHO to be able to reopen. First, I wish to situate us as far as the debate is concerned. Since the beginning of the crisis, Quebec has made 43,000 tests per million inhabitants. And I'm giving you examples. In Ontario, it's 31,000. In Germany, 33,000. In the U.S., 30,000. In France, 21,000. So Quebec is one of the places in the world where up until now we have conducted the most people. However, However, and I'm not trying to hide from this, we were doing 6,000 tests per day. We told you about a week ago that we wanted to increase that from 6,000 to 14,000. Yet we've gone up to 9,000, 10,000 on Friday, but now we've gone back down to 9,000. I just wish to tell you that this is not something that I'm accepting. I'm not happy about it. I told the people involved that I hope that in the next few days we will be able to increase that to 14,000 tests. That means getting things better organized, and it also means to better inform the public in the different neighborhoods, for example, in Montreal, about the availability of these tests. So I'm taking part of the blame by saying that we do have to better explain that the tests are now available at large scale. So that is for the tests. So just to tell you that I am following this file personally. So I am looking at that myself. Good news. For the third day in a row, we have employees who are coming back from sick leave. So they're coming back in the health network. Just yesterday, we had 250 employees who came back to the health network. Of course, that has to continue. And that is very good news. Another good news, and not that I mean to scoop my colleague Isabelle Charret, but this afternoon, together with Dr. Massé, she's going to be announcing that we will be allowing individual sports that have no contact. I'm giving you two examples, golf and tennis. I think that this will make a lot of people feel better. Me first, I think that it would be good to go play tennis with one of my two boys, while not being sure that I'm the one who's going to win. But anyway, that's an entirely different topic. A word on the opening of the National Assembly. So after 2 months, today we had our first question period. I think that it went well. There was a good tone, collaboration. I wish to take advantage, as I did at the National Assembly this morning. I want to salute and congratulate the new head of the Liberal Party, Dominique Anglade. Also thank the interim President Pierre Arcan, who was there during that period. And my daily thanks are going to be for all those members of the National Assembly. It is important, their role, the 25 who were there, who have the responsibility of listening to the citizens of their ridings and to bring the concerns of those citizens to the National Assembly. So it is healthy to criticize the government. It's not always easy to get criticized, but, you know, we do end up getting somewhat used to it. And it is healthy for democracy. And I wish to thank all the members of parliament, all the political parties. We've had very good collaboration in the past 2 months, and it's important that it keep going. It is together that we'll be able to get out of this crisis. And I am happy to see that our parliament, our national parliament, is working well. And we had an example of that this morning. And I would like to end by saying, by coming back a little bit on the guidelines and everything else that will come, it's pretty obvious that over the next few months and perhaps even the next few years, there won't be a vaccine. We'll have to learn to live with this virus. And if we wish to come back to a more normal life as quickly as possible, it is important to follow the guidelines. So we add the mask, but we cannot forget to always keep the 2-meter distance from other people, washing one's hands regularly. And I am convinced, and Quebecers have shown it since the beginning, that they are able to follow guidelines. And together, as Quebecers, we can win this fight against this virus. And we are able to possibly come back to a more normal life eventually. So I count on all of you, all Quebecers. We can get through this and come back to a slightly more normal life. English.
First, I want to talk again about our recommendation of wearing a mask. For the moment, we won't make it mandatory. We first want to make sure masks are available to all the population. but I'd like Quebecers to make a habit of wearing one in public. If a majority of people do so, it will help us get back to a more normal life. I also want to say a word about our testing capacity. We're one of the places that test the most in the world, but we were supposed to increase from 6,000 to 14,000. Unfortunately, we didn't deliver. We are now at 9,000, so I'm not happy. I've told the responsible people that we have to reach the 14,000 a day in the next few days. So I repeat our three rules for when you go out. You keep your distances, you wear a mask, and you wash your hands when you come back. I'm counting on you all. Thank you.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Premier. So you've seen today that I am wearing a mask. I'm going to ask the first question. If I've heard correctly, your clarifications when you opened up on the masks and the quantities that would be necessary to make it mandatory, it remains that every time that the question of the mask comes back, you always come back with the argument of the legality. And you said that this morning in the Salon Bleu. Why not having said earlier that basically it's a question of the availability that explains the position of your government about the mask? And once it is available, will you be imposing it, for example, in the Metro of Montreal? Well, first it's important to say so. There's a question of availability, but also a question that up until now, public health had made a recommendation of it, but never an obligation. So we also base ourselves on what public health says. So on that aspect of it, it's very clear. As far as how things will unfold is concerned, we're going to start by making sure that masks are available in large quantities. We are also going to be looking at how the guidelines are followed by Quebecers before making it mandatory. And as far as the legal aspect is concerned, well, of course, we have to have high-quality masks that are available in order to be able to make it mandatory. But I believe that we can get over the legal aspect as we did for confinement in people's homes. So first, we have to make sure, first of all, that it is available. And second, we have to make sure that if it is the case, that public health asks that it become mandatory. And if you allow me, when we make a legal analysis, we look at all these elements. You know, when we're talking about the legal elements, it is the availability, the non-discrimination towards certain groups, the efficacy of our measures, etc. So it was in that perspective that it was said. And on top of it, what can also be said is that the movement of integrating it like an element, not of saying it's sufficient 100%, but it is part of the respiratory etiquette. It's a social standard that we can now decide to impose as such. But, you know, all those factors, because there's never just the one reason, but all those factors are part of the legal analysis, you know, making it available or not. Together with ministers in your cabinet and your government, you created a group of action for the economic recovery. That was a month and a half ago. You said that all of your commitments would be reviewed, taking into account their impacts on the recovery. You already rejected the idea of putting aside the troisième lien, the third link. Do you still wish to continue with the deployment of kindergarten for 4-year-olds despite the pandemic? Are there projects that you're going to leave aside to avoid that we end up, you know, with a deficit that would be too difficult to catch up? Well, first, everything that was planned for the length of the mandate, there will be no project, no significant project that will be put aside. So all the electoral promises, all the commitments that we had taken for the length of the mandate are going to be respected. Now, we continue analyzing over a period of 10 years what the investments are. Could we review certain investments that are further away than the 10-year period in order to be able to take into account the fact that we are going to have a deficit that will be increasing our debt? It is being analyzed as we speak. But for the time being, we have concluded that for the length of the mandate, all the commitments that we had taken are going to be respected. So nothing is going to be reported. Happy to see you again, Mr. Legault. And first, I would like to say, return to the National Assembly. There's Marguerite Blais, who attempted to answer the questions of the opposition leaders, and some said, well, in the context where you want to reform the CHSLDs, it might not be the best person to answer those questions. And some people are even saying that right now. She's almost a decorative she has a decorative function in this crisis. Do you still trust Ms. Blais for this file? Yes, absolutely. I trust Marguerite Blais to bring this file to term. She knows it so well. And I perhaps want to quickly remind everyone of what's taken place in the past year and a half. We had promised during the electoral campaign to better fund CHSLDs, to review the wages of the people, for example, the orderlies in CHSLDs. And in the past year, we have significantly increased the budgets of CHSLDs. We have set up, Marguerite Blais set up, the entire project of the elderly homes, where we wish to have more space with, in total, fewer residents in each home. And where, perhaps together as a government, we made an error is that we waited for the bargaining session at the end of the collective agreement that was ending on the 31st of March 2020 to review the wages of orderlies. What happened basically is that we increased the CHSLD budgets by many hundreds of millions of dollars, but we posted positions that were never filled. So it's a challenge. It's not simple to bargain. Talk about it with Dr. Barrette, to bargain with unions to have wage increases specifically for orderlies. But I am determined to succeed, even if it has to be done unilaterally. As far as wearing masks are concerned, you said that we don't have enough to make them mandatory. Are there steps being taken by the government to procure them? And if so, how will it be done? Well, we are discussing right now with many Quebec companies. Our priority at the beginning of the 2 months that we experienced was to first procurement in masks for the health network. So the N95 masks, the surgical masks. So on that end, we're pretty sure we have 30, 40 days worth of reserves for those masks, so that is under control. Now, for the population, as I was saying, we would need tens of millions of masks. So there are companies who are telling us, well, I can deliver 500,000 to you or 1 million. Well, just in the Montreal metro, we wouldn't even get a week's worth out of that. So we have to accelerate. And I trust, I have confidence that within a month we will be able to, in Quebec, to manufacture masks for the public, for everyone that wants them, so that they can wear it.
Bonjour, Monsieur le Premier ministre, Madame la Ministre, Monsieur Arruda. Justement, sur la même question des masques.
On the same question of the masks, I don't understand why we're going about it so late to procure masks for public transportation. The New York Metro has millions. In Paris, they have 2 million that are being distributed in 400 stations right now. Why is it that we don't have them yet? Did we start too late to go get those masks? Why does it take longer here than elsewhere? Well, it doesn't take longer here than elsewhere. First of all, if you look at the case of Paris or Germany, 150,000 masks. At some point, you have to look at how many masks were given. We could also give masks, 500,000 or 1 million masks tomorrow morning if we wanted to. But what did we do the day after tomorrow? So there was a race to masks, internationally speaking, first of all, and you've experienced it in the past 2 months. Everybody was looking for masks. And I don't think, I'm convinced that we are no different from anywhere else in the world. Everybody's looking for masks. Now, of course, in New York, people wear masks a lot that are made at home. And I invite Quebecers to make their own homemade masks as much as possible. But I give you that challenge, Mr. Lacroix, to find 25 million masks or even 10 million masks. And you'll see that it's not as simple as you seem to think. Well, it's not my job to find masks either. I'm not specialized in that either. You said earlier on that you were going to be looking at that you'll see how Quebecers behave before making it mandatory. Does that mean that we're going towards mandatory mask wearing? What you're waiting is to see how people react to this recommendation that you have been making now for a few days before seeing whether to make it mandatory or not? Well, yes, first of all, I'd like to remind you that we started recommending wearing the mask the 24th of April. It's been a while. We did not make it mandatory. I think that, of course, before making it mandatory, for example, in public transportation, we would have to have a recommendation from public health in that direction. For the time being, we don't have any indication from public health that it will be mandatory. I am not excluding it. We are not excluding it. But for the time being, we're not there yet. And yes, I want us to see, and I think that wearing a mask, for the past 2 days at the press conference, I think that it sends out a signal to Quebecers. I see that certain journalists are wearing them today as well. I think that we are going to see more and more people wearing masks. Will it become mandatory? Will it become necessary that it be mandatory? Well, we'll be following the situation over the next few days and weeks. First, we have to make sure that we have masks that are available for everyone. Ms. McKenna would like to know, where are we at with the works of the expert committee that you put together, I think, about a month ago? Well, they're very active. They're in link with us, and they have made many recommendations, close to 20 of them up until now. And we are following those recommendations. So it's a group of experts that is very active. They made recommendations for CHSLDs, obviously, because that's many geriatricians. So that's very helpful. They work together with Madame Blais' team, the minister responsible for caregivers and the elderly. So it's very constructive, and it has been helping us in the different files, for example, screening, the dedicated teams, infection prevention. So this is a really interesting input to the action that we want to pose, and they're going to be there with us for a good amount of time, because we know all of these things are things that we have to do for the long term. Mr. Ruda, we just went over 2,000 deaths in CHSLDs in about 2 months. To have an idea of the scope of things, in March, April 2019, how many people died in CHSLDs? I know that you won't have specific numbers, but just to give us an idea to compare. Well, clearly, there's an excess compared to the same period. I can't tell you the quantities. I looked about it a few weeks ago. It's an important element because we know that mortality and overmortality is associated to COVID-19, and we're looking at how much it contributed as extras. But I could make the analysis and show it to you later so that you can see it. And it will be a very important piece of data with all the limits that it can hold, with all comparisons, because, all not systems are the same. But to adjust, the phenomenon of declaration and non-declaration in the different countries, particularly in the countries that are in the same hemisphere that had about the same flu season as we did, I think that'll be important. You got us used to, right from the beginning, by saying, and it's the national director of the WHO who said we have to do many things quickly rather than not doing anything. Is wearing the mask, was it brought too late to Montreal? The most important contribution, in my opinion, to reduce the epidemic, and I'm talking here, it's not wearing the mask within a community. It was the measures of confinement and social distancing. Without denying the fact that a mask is a tool, particularly when there's a lot of community circulation. I'm not saying that that wasn't the case in Montreal, but it was not as intense as it would have been had we not confined. There is the CHSLD drama, yes, and as well as the healthcare workers who were infected as well. That's also another drama, who infected certain clusters. But the contribution of masks, in my opinion, is an extra tools, but which does not replace hand hygienes, etc. So the movement associated to wearing masks in Occidental societies, Western societies, is pretty recent. Even the WHO did not recommend at the beginning, then they recommended. Then, we could do the entire history in time, but I think that wearing a mask, is it too late? I don't know to what extent the mask in a community practiced in Quebec in a phase where we were confined, whether it would avoid deaths. I couldn't tell you whether it would have saved 2 deaths, 3 deaths, 4 deaths, 1,000 deaths. I don't think it would have been at that level. But now that Quebecers have learned to understand the importance of washing their hands and those kinds of elements, I think that adding a mask as a method, and you also have to understand that we have a scarcity of masks, you know. We can't tell people that they require a mask if we don't have any. And we haven't worked out everything having to do with face coverings as well. But the 24th of April, I recommended it very strongly. We made videos. We showed you how to do it with the scarf, etc. But now to make it mandatory and for everybody to be able to do it, it also takes a collaboration of the population. I think it is part of a normal step to get people used to doing things. That's what I can tell you for the time being. But we'll see with the history, and we'll see how good of a tool it is, but it does not remain an instrument of which, and I'm talking about scientifically, you know, I would tell you that probably even the psychological effect, or the effect of saying the other person is not wearing a mask, I won't get too close, that is a factor of social distancing that is going to be more important than the efficacy of the mask itself. So that is why I believe that we are strongly recommending it, and I've been wearing one. You know, if I move around in Montreal, I'm going to be coherent with what I'm saying, and I'm going to wear one to, you know, give a good example. But up until now, myself nor anybody in the family was I recommending it. I recommend to the public exactly what I recommend to my family for its protection. But today, with things as they are, I believe that Quebecers, if they wish to at once, you know, if 2 people wearing them, they protect themselves mutually. I think that that will become a social norm. And we'll see about making it mandatory, not when we have conditions, because we do not want to increase the health inequalities. That is, that, you know, people who have more money, who have access to masks, even if it's not very costly, even if it seems to be very simple for certain people, it is not easy. And I think that we have to respect that balance in health. I am a little concerned right now with the situation that we are going to be experiencing over the next few weeks in the public transportation. I think that in public transportation, we can stay many minutes in the presence of somebody else, and sometimes we can be less than 2 meters away. However, in the past few months, there were very few people in the metros and buses, so it didn't concern me quite as much. We know that in Montreal, for the time being, it has not been chosen to open, we didn't choose to open, you know, schools or businesses. And high school, where there's a lot of people who take the bus and the metro, is only going to be in September. So as we go along in the next few weeks, as there are more people taking the metro and the buses, then it will become really important to wear a mask. But I did not feel that over the past few weeks, taking into account that there were not very many people in public transportation, I think that it is important to, you know, put it in people's minds that the 2-meter distance, that is the key. But the 2 meters is more difficult in public transportation, especially if there's a lot of people using the buses and the metros. That's why I'm wearing it today. There's a lot more people at the National Assembly, including people who come from red zones. Well, we had to be careful, because from what I've understood is that when you cross somebody in the hallway, I mean, so what was explained to me, you can't just catch it when, you know, you spend a couple of seconds crossing somebody. It's when you're in the same room, perhaps like here, you know, this could be a possibility, you know, where the germs can move around. But to walk and cross somebody going the opposite way in the hallway, you know, the mask is when you're less than 2 meters away from somebody for many minutes. The 23rd of April, I recommended it, but I strongly recommended it on the 24th. The 24th, I'm sorry, sometimes I don't even know what day we are. So the 24th. I strongly recommended it. So decode what that means, to strongly recommend something, but making it mandatory, there are conditions that are just not there, especially for the most vulnerable people. If you can help one another out to, be able to get masks, well, let's do it. But in the meantime, we have to wait to have the manufacturing capacity. Mr. Legault, you are a man with objectives and plans. You like having objectives. I would like to know, what is it that you are hoping to get as a result for the 2-day mission that you're going to have in Montreal? What are your objectives? Well, first of all, I wish to meet the mayor of Montreal and the people from public health in Montreal, see what the constraints are, what the challenges are, what the situation is. I also wish to meet the CEOs of the CIS and the CIUS. I want to know what happened and what is happening right now and what we can do to help them, because, the CIS and CIUS presidents are the bosses of the CHSLDs, at least those that are public. So I have a lot of questions to ask them on what's happened in the past 2 months and what's going on right now, and to see the ways in which we could help them further. I'd like to come back to the question of masks. So you talked about the volume of masks that would be required to, supply people taking the Metro of Montreal. Do we have any ideas of how many what our stocks of masks are right now and how many we would need daily in Quebec for the metropolitan area? In terms of quantity of masks, there's the Metro, but it goes beyond the Metro as well. Well, yes, that's what it is. As I was saying earlier on, N95 masks and surgical masks, procedural masks, we have enough of those for 30 to 40 days. So that's under control, and we are continuing to get procurements. Now, there are many hypotheses on the masks for the public. There are one-time usage masks and washable or reusable masks. We're working on both of those aspects right now. So, we could have a few million masks tomorrow morning, but we would only get through a few days with those masks. So we are there for the time being. Are we going to manage to find tens of millions of masks? I trust that we will get there in the next few weeks, in the next month, but we're not there yet. Mr. Premier, I'd like to come back to the issue of the tests. You said that you did not accept the present situation, that you had talked about it to the people responsible. I want to understand that, because yesterday, or for the past few days, to explain the increase that was lesser than what was planned. You said, well, people were not there, people were not, answering the call, whereas there are health workers in CHSLDs where there are cases of COVID who are not being tested at all, and they told me that there are no guidelines about this. So I would like to know, who did you speak to exactly about that question? What explanations were given to you, and what concretely are you planning on doing to correct the situation? Well, yes, you have very good questions that are similar to my own that I've been asking those people who are responsible. What I understand is that the clinics that were set up in Montreal, there weren't as many people as was thought that went to get tested. However, we have a lot of work to do in CHSLDs. So those people, if we had known that the public wouldn't be there in the hot zones, well, we would have put them in CHSLDs, and that is what we are doing right now. We are working on both fronts. We're working on the organization, so where the staff should be, the staff that is conducting the tests, where are they? We hope that is where there are needs. And there are needs in the public as well, and there are needs in the health network. So right now we are spreading out the people to the correct places, but ideally I would like for us to be able to do everything. So to test within the community correctly, and also test in CHSLDs, amongst other places. Okay, well, maybe a part of the question wasn't answered, but maybe my question will go to Ms. McCann. Maybe it was a bit delicate to answer, I don't know. Ms. McCann, it's been about 10 days that the list of CHSLDs and residences for the elderly was withdrawn where there are cases of COVID-19. Please tell me, as we speak, how many CHSLDs and RPAs where there are COVID cases, how many are there that have at least 15% of cases, and how many CHSLDs and RPAs are in a critical situation? Well, I'm going to answer you because this is a file that I've been following on a daily basis. When we look at the residences where there's at least one case of infection, there are 332 of them. 109 CHSLDs, 131 RPAs, 72 RIs, and 20 other environments. So why? And that is a question that I'm asking. Why? And I'm going to give you the answer that I got this morning. Why don't we have it residence per residence, the breakdown with the percentage? The statistics were made according to the number of beds. So this many people infected divided by the number of beds gives, whether we're at 25%, 15%. We know that there are beds that are empty. So right now they are taking all the data. It was promised to me that perhaps even this afternoon they would be done with that work, at least for the case of CHSLDs. What we're missing now is the denominator. That means the number of infected people. And we have them, and I'm going to give them to you on top of the numbers. There are 5,139 infected people. Two RPAs have 1,162, 854 in RIs, 174 in other areas, 2,949 in CHSLDs. So now what we want is to know what the percentage that represents in residents and not what percentage of the beds in those residences. So they're completing that work. And I was told that in the case of CHSLDs, they should be able to put it online this afternoon and for the others tomorrow. I would like to add, if you allow me. Yes, of course. We are going to be giving you a little bit of a scoop, and we're always very prudent because it's not over, but you will see that in the chart, probably this afternoon, we hope, that CHSLDs that are in a more critical situation, the red zones, the number has decreased. That is what I want to tell you for the time being. There are as many in total, if not more. There's 300, as the Premier was saying, RPAs and CHSLDs. But as far as the red zones are concerned, those that have 25% and more of cases of infection, there are fewer of them. And that is because there are residents who are getting cured as well. So that is good news. But once again, we are continuing because the situation is always difficult. It's still difficult, but it's evolving a little, and we wish it to evolve further, of course. And just to be clear, even clearer, there is no information that is being hidden, okay? I would love to have that information that you are asking. And all the information that I have, I give to you. And as soon as I will have the information, residence per residence, I'll give it to you. So there's no question of keeping anything from anybody. We're 100% transparent here. This is my brand. And a little scoop, since I am the Minister of Health, and there was a little bit of good news, so that's why.
Vous avez fini, vous êtes certain? Bonjour. Harold Lebel, ce matin, en a parlé.
This morning it was talked about the cases of people who unfortunately are still dying alone. There's a lot of those individual examples, case-by-case situations where the guidelines don't seem to have been heard. We've already asked you whether the information does go all the way down to the, throughout the network. The question that I'm wondering is the CEOs also have obligations of means in the network. But who has the obligation of results? Okay, the caregivers. At the top, we decided for a long time that we did not want to force the managers of the establishments of accepting caregivers. So for a long time, we told ourselves that it is the best way to avoid the spread of the virus. So we were at the top and at the bottom, all responsible. Last week, together with Marguerite Blais, we reversed the burden of proof. We also eased the visits of caregivers. That made people talk because we said, well, now no need to have tests. 2,600 residences there are. There are caregivers that want to see their mothers or fathers, help them feed themselves. And we're not going to start doing that in 2,600 residences in installing a process of testing. So we're going to supply the personal equipment protection, the masks and the gowns and the gloves, and depending on whether you're in a hot zone or a cold zone. However, we will allow the caregivers to go. And if ever a caregiver is not given access to the person that they want to see, we absolutely want to have the report saying that the establishment, will say so. What I've been told is that there were only 8 residences or CHSLDs that gave good reasons to not welcome. They gave those exceptions, but until further notice, all residences are accepting caregivers. I think it's a question of humanity and of balance between, yes, avoiding the spread of the virus, but after 2 months, there are people who need seeing their families, and I think that it's just human to allow that. And also, it's a question of time sometimes to give training for the establishment to, pull itself together, not for weeks, but maybe over a couple of days. But the echoes that I've heard is that certain places, and I think that this will be general, caregivers are very welcomed. And also, it's good for the staff because it helps them out. So they're happy that the caregivers are coming in. But it does take some time to get organized, to give the training. But here we're talking about a couple of days. We're not talking about weeks. If you'll allow me, I would have the information that was asked earlier on. The communication is pretty pertinent. If you'll allow me, in the month of March and April 2019, so last year, we had 12,800 deaths. In 2020, we're at 14,009 deaths, which makes a difference of 2,209 deaths. 2009 or 2020 deaths that would be in excess of the comparable data. We, as of the 30th of April, we had put in our system 2020, that is 2020. We have a difference, I would say, of about 180 deaths in the excess. One can be an excess that is not necessarily associated to COVID-19, but there are also the fact that as of the 30th of April, we still have cases that have perhaps not been entered. What that shows is that our system detects probably the excess, the death excesses. So the system is capturing the deaths correctly as such. So that is good news. That's what we've been saying since the beginning. We do have a system that is capturing those deaths correctly, and we'll see at the end of a few weeks whether there are other deaths being added to March and April. It's normal that we don't have the exact number, but we are at less than 10% of overmortality. So 2,209 people for the 2020 that we gave you, which is about 189 differences if I'm counting properly. I'd like to go back to my question. Are there still people who are dying alone? And in the health network, does everybody have obligations of means, or are there also people who have obligations of providing results? Well, listen, I expect that there are results, obligations everywhere. I understand that, no one should be charged beyond their capacity. There's an important lack of staff, and I think that the positions have been filled pretty well. But of course, the people who are there, including the soldiers and the volunteers who are paid, they don't all have the qualifications, perhaps, but giving attention to somebody who is dying, I think that the services are given, and the caregivers of that person, well, right now they are welcome. And also, if you'll allow me, Mr. Premier, let us remind ourselves that at the beginning of the pandemic, we were saying, well, we can go visit when the person is at the very end of their life. We had that change. We spoke of palliative care and of the person who's not at the very end of their lives. You know, they can be in palliative care at the hospital and like in palliative care homes, you know, in the broader sense. Palliative care meaning somebody who doesn't have treatment and who's heading towards the end of their life. And we open the door so that members of the family, so that significant people come with certain guidelines, of course, but that should be applied everywhere. Everywhere. So, of course, if it's still happening or not happening, we'd like to know, to make reminders, but that is an obligation of results. Before going to English, since you were generous with your answers, Mr. Laforêt, to end with? Thank you. It's fine. All right, English questions now.
Hi. There's a new Léger poll that suggests that non-francophones are more worried than the francophones about the confinement plan and catching COVID-19. Are you concerned your message is not evenly accepted in the population?
I think the journalists, you have a responsibility. I like to read certain journalists of the Gazette, the specialist in health. Sometimes I really disagree with him. It's a question of information, so I'm trying to do my best in French and in English, so I don't see why the result is not the same for francophones and anglophones. I guess maybe the Gazette has a certain responsibility.
Why was testing going to close in Montreal North? Was this premature?
The what?
In Montreal North, the testing was going to close.
No, it's not closing.
No, it's not closed anymore. And I know that, I know that the mayor of this region was not happy against me because I told that there was not enough people getting into the clinics. That was the information I got. So I'm sorry if my information was wrong. But in fact, what is happened is that because the buses were not available at the time they were planned, they decided to keep the clinic open. And actually, the things are done. And I just called Dr. Drouin to have the impression how much tests have been done, and she told me that with the Center for Dépistage and the buses, she already had done yesterday 2,818 tests. The objective for that for Montreal is 3,080, so there is around 200 tests more to be done, and probably this is the data for yesterday, and probably that today we will be able to catch up the 3,000 tests in Montreal. There was also a new test done in Laval. They done 524 tests. Their objective is 750, and in Laurentide 365, and the objective is 705. So things are getting up, and I hope. I will look every night or every morning when we get the data from the other day, the day before, that we were going to be around the numbers I told you we were supposed to be next Friday. Last Friday, not next, but next Friday.
Philotier, Montreal Gazette.
Good day. Were you talking about me?
No. Aaron something.
Yeah.
He's on Twitter about 25 times a day.
Question. The president is watching me. Montreal Public Health Director is still saying that some restrictions may have to continue in Montreal past May 25th. Realistically, today, are you able to say you will be able to give Montreal the kind of deconfinement status as the other regions have after that date? Is it realistic to think, or is this still going to be a longer haul?
If the situation is not improving, we won't reopen. So we have to see an improvement.
And I'm wondering if you could, we've been trying to get those numbers about the CHSLDs, the infected numbers for quite a while. You said there are 332 which are considered hot or problematic?
They have at least one case.
At least one case. Is that going up, and is the number of persons infected going up? Because that information has not been available.
I have the information from tomorrow, so it's same number than yesterday, sorry. So, and the number of people has decreased by 21 since yesterday.
More than 2 weeks ago.
Hey?
It's more than 2 weeks ago, right? These numbers?
I think we were at about 300, maybe. So maybe there's 30 more, yeah, something like that. We were around 300, 310. So maybe, a small difference.
Can have more, but with only one case. It depends. Right. It's why with the new data that's going to be collected that the Prime Minister announced, we're going to have a better knowledge of what is going on.
Katsone, CBC News.
Good afternoon. You must have been surprised, Mrs. McCann, to see that cold hospitals such as Honoré Mercier in Saint-Hyacinthe are seeing outbreaks of COVID-19. And what can you do to ensure that basically hospitals are not overwhelmed? And Radio-Canada was also reporting that it's due to a lack of staff and staff working in CHSLDs that are basically working in hospitals. So how can you make sure that those cold hospitals are protected?
Yeah, we're doing everything we can to do that. And unfortunately, it can happen. That a hospital was considered cold has an outbreak. It could be 1 or 2 cases. And it's certainly possible. But what I'm confident in is that the measures are known. And now we have experience. We're not at the beginning of the pandemic. People know exactly what to do. We knew from the beginning, but now we have experience. So they know exactly what to do to really confine this situation. We've seen it in different hospitals in Montreal too. We're able to confine the situation and prevent more outbreak in the hospital. So unfortunately, it's possible that it happens incidentally. We don't want it to be a general phenomena, obviously, but we will contain those situations, and I'm confident that it's going to be well managed.
Excellent. Regarding masks, can I ask one clarification about masks? And then my second
quickly.
question. When I heard you talking about the strategy of getting companies on board, the words that I had in mind is crisis management. Do you have the impression that we should have seen masks and the need for masks coming earlier in Quebec?
I don't think so. I think that when people were at home, so there was no question about should we or should we not wear a mask, while the collective transportation was empty, there was no question about should we or should we not wear a mask. But now that we are reopening, especially outside of Montreal, I think it may happen in buses, for example, that you be at less than 2 meters for a certain number of minutes. So the mask is becoming more important. Same thing with the opening of stores. There are some stores where you have many people, and sometimes people are waiting at the cashier place to pay for more than a few minutes. So I think it's becoming important to wear the mask more than it was a few days or a few weeks ago.
Last thing about Montreal North. Yesterday, you were talking about the criteria to get tested, for example, in Montreal North or in Montreal. And the CIUS in Montreal say that you have to have symptoms or come into contact with a person who tested positive. We heard here, if I remember well, that you have to. You said that if you came into contact with someone with symptoms, so many people thought that they could go and get tested without symptoms because of what you said, and now there is a lot of confusion. What's the word on the street to get tested in Montreal?
We must understand that the strategy for public health in the community is based on the decision of the directors of public health and what is going to be done. And I just want to say that there is going to be a big operation with the healthcare workers and everybody in CHSLDs that is going to be launched. Actually, all the CHSLDs and even houses for elderly people are going to be tested in a point of time in the next month. There is more than 48,000 tests, 48,000 workers that are going to be in the first step one on CHSLD to be tested. When there is a case, there is testing, but sometimes the testing is only in one floor or in odd zones, not everywhere. But now there's going to be a big operation on CHSLDs, on the communities, actually, what Dr. Mylène Drouin recommends and what is going to be done also in Montérégie is that if you have symptoms, you go, before we told people stay home. If you don't have any symptoms, don't go outside and stay there for 14 days. Now we are asking those persons to go to be tested and their family, which has contacts, close contacts of co-workers, to get tested. The asymptomatic person, actually, that is not at all in contact with a case, okay, is not recommended to be tested right now. There's going to be another step. And there's going to be also serologic studies that will be done to catch up those asymptomatics to see what was going on. So I think the best first step understanding is to make sure that you go to your public health, like in Istria and like in Sherbrooke or Istria, the director, based on his epidemiology, could choose another. So they've got all a quota of tests that they use in the best way, because the situation in Montreal North, is not at all the same as the Westmount, and it's why they are trying to do that, to have the best use of the test.
Thank you. And two last questions from Raquel Fletcher, Global News. The first one is for Mr. Legault. What is your reaction to the Canadian border with the U.S. remaining closed until the end of June?
I'm very happy. I think it's important that we keep the border closed for as long as possible. So I was happy about this decision.
Répétez en français, s'il vous plaît.
Oui, je pense que c'est important.
I think that it is important that the borders with the United States, that the ban be maintained for a good amount of time. So I'm happy that we are keeping the borders closed at the very least until the end of June.
Raquel is about, I think, the numbers that you told us. We still have no updated numbers on the current situation in CHSLD, but anecdotal information says it's very bad. How many CHSLDs and RPAs have infection? What percentage?
Okay, so we have 332 centers, so it's not only CHSLD. There are 109 CHSLD that has at least one case. And the only reason why we're not giving, since a week, the data per residence is because we don't have the number of people living in those residences. And we expect to have these data this afternoon for the CHSLD and tomorrow for the other residences.
So thank you very much. C'est ce qui complète pour cette conférence de
This puts an end to the press conference. Thank you.